So hello friends, welcome to my new video, and today in this video I'm going to discuss with you all about hyperthyroidism. Let's start. So before starting this discussion, first of all we need to know about the thyroid gland. So thyroid gland is an exocrine gland which is situated in the anterior neck just below the laryngeal prominence, that we also known as the Adam's apple. So there is two type of glands are there. One is exocrine gland and another is endocrine gland. Exocrine gland secrete enzyme and endocrine gland secrete hormone. So thyroid gland is an endocrine gland. So you are looking at the thyroid gland now, and as you can see, thyroid gland is having consist of two lobes which is connected by the isthmus. Okay, and below the thyroid gland there is trachea, and above it it's the thyroid cartilage. And you are also seeing the Adam's apple, which is known as laryngeal prominence. So this is a flow chart that I made so that it will be easy for you to understand how this thyroid hormone produced. So when there is low level of thyroid hormone in bloodstream, then hypothalamus detect this low level of thyroid hormone in bloodstream, and it secrete thyrotropin releasing hormone, that is also known as TRH. And this TRH activate the pituitary gland, and it secrete TSH, thyroid stimulating hormone. This TSH reach to the thyroid gland, and now thyroid gland is consist of thousands of follicular cells. So TSH bind with the TSH receptors of these follicular cells, and it regulate the production of thyroid hormone. So apart from these follicular cells, there is another parafollicular cells are also there, which secrete calcitonin, and follicular cells secrete T3 and T4. Now T3 is known as triiodothyronine and T4 is known as T4. So the main hormone secreted by thyroid gland is T3 and T4. So after get secreted from the thyroid gland, these T3 and T4 mixed with the bloodstream. Okay, and now it is also seen that T4, that is known as thyroxine, get converted to T3 after some time of its secretion from the thyroid gland. So what is the function of this T3? So T3 help in maintaining body metabolic rate. So cell can produce more protein and burning out more energy in form of carbohydrate, and also it maintain the proper brain development, also muscle control, and it increase the cardiac output. It also improve the digestive system also, this T3. So thyroid hormones are very much important for our body, and it's also very important for those newborn infant. They should have proper thyroid hormone secretion for their proper body growth and development. So now let's move to hyperthyroidism. So from this term we can understand that what is going on. That is, hyperthyroidism means excess production of thyroid hormone. That means excess synthesis of thyroid hormone, that is known as hyperthyroidism. So it can be due to several reasons. First cause is Graves' disease. So it is an autoimmune disease where the beta cell provide antibody against the thyroid gland protein, which is all known as thyroid stimulating immunoglobulin. So this antibody bind with the TSH receptors of the follicular cells of thyroid gland, and they regulate more secretion of thyroid hormone. So what it does, that it ultimately increase the level of thyroid hormone in the bloodstream, which can lead to several symptoms that we will discuss later on. Now another cause will be that thyroid adenoma. That means it is like thyroid cancer. So here, due to this thyroid adenoma, the cells of the thyroid gland uh, have growth abnormally, As a result, there is abnormal growth of the thyroid gland will be seen, and due to this thyroid adenoma, there is increased secretion of thyroid hormone. Now, excess intake of iodine also can lead to hyperthyroidism, as we all know that iodine is very important for production of thyroid hormone. So if the person is having excess amount of iodine intake, then it can lead to more production of thyroid hormone. So if a mother is having pregnant, then and she is having Graves disease, so that also transformed to the baby by the placenta, uh, and the child can also have the hyperthyroidism. So what are the symptoms of hyperthyroidism? So first of all, the symptoms include weight loss, rapid heartbeat, increased appetite, sweating, sensitivity to heat, and fatigue, because there is more metabolism going on into the body, as well as more cardiac output is there. So everything is very much due to this elevation of the T3 level. So it ultimately lead to these symptoms. Now, there is ocular changes also can seen in hyperthyroidism, and it is divided into 6 grades. In grade 1, there is no eye sign is there, but in grade 0 there is no eye sign. In grade 1, there is upper eyelid retraction. Grade 2, there is proptosis up to 22 millimeter. So what is proptosis? Proptosis means bulging of the eyeball outward. Bulging outward of the eyeball is known as proptosis. So in grade 2, proptosis up to 22 millimeter. In grade 3, the proptosis is getting more severe, and proptosis that more than 22 millimeter outward is there, as well as epiphora. So why epiphora is there? Because due to that proptosis, the more amount of ocular surface is exposed. As a result, there is a need of more lubricating those ocular surface. So epiphora is there to maintain a proper lubrication. That is by the help of tear films. So there is more lacrimation is can be seen. Now in grade 4, now in grade 4, involvement of extraocular muscles can be seen as the eyeball is getting outward. So the extraocular muscles have also have involved, as they are not able to control the eyeball properly. So there is a tension is going on. Now in grade 5, there is a corneal involvement. Why it is there? Because due to that proptosis, there is not that much proper tear flow is there, as well as tear distribution over the ocular surface. So cornea is getting stressed very much, and it is now involving, as well as the conjunctiva is also involving, so it leads to dry eye and also redness. Now in grade 6, there is optic nerve involvement and complete blindness. So if the proptosis is getting more and more severe, then it ultimately lead to effect on the optic nerve, which is the most important nerve, as it is because of that optic nerve we are able to see the things properly. So if the optic nerve is affected, then there will be visual impairment can be seen. Now what is the diagnosis? So blood test is performed, that blood test is performed to confirm hyperthyroidism by measuring the level of thyroid hormone in the blood, as well as also measuring the level of TSH. So if it is due to Graves disease, then TSH level will be decreased, because in Graves disease the beta cells antibody are attached to the TSH receptors and they are regulating more production of thyroid hormone. So TSH level will be reduced. But if there is presence of any tumor at anterior pituitary, then pituitary hormone can lead to more secretion of the thyroid hormone, so it ultimately lead to hyperthyroidism. So at that condition TSH level will be elevated. So now another is thyroid ultrasound. So why thyroid ultrasound is performed? So it is performed to see the shape of the thyroid gland, whether it is in normal shape or abnormal shape. So it is done to see any type of cancer in the thyroid. So in thyroid adenoma there is abnormal growth of the thyroid gland is there. So to examine that thing, thyroid ultrasound is performed. Now radio iodine uptake test. So in this test a small amount of radio iodine is taken by the patient in form of a capsule, and the doctor will see how much will collect, how much of this iodine will collect in thyroid gland, and it will be checked after 6 hours or 12 hours. So a high uptake of radio iodine intake, um, it indicates that more production of thyroid hormone, and most likely cause it can be Graves disease or abnormal thyroid gland functioning. So what is the treatment? So treatment is radioactive iodine. So here in radioactive iodine test, small amount of radioiodine is given to the patient, but in radioactive iodine therapy, here more amount of radioiodine is given to the patient in form of capsule, and as we know that iodine is very important in producing thyroid hormone, so when the patient is given radioiodine capsule which is containing the radiation iodine, so that dose, so the thyroid will take this radio iodine as it is very important for thyroid hormone production. So after it get absorbed by those thyroid gland cells, then this radiation iodine, that is radio iodine, will kill those cancer cells of the thyroid gland, and it ultimately lead to treatment of those mm, thyroid adenoma or cancer of that thyroid gland. So this is the treatment. Another is anti-thyroid medication. So anti-thyroid medication, there are certain medications or that is certain drugs that leads to decreased production of T3 and T4, and the drug which is known as tepazole. Beta blockers propranolol is used, and surgical procedure, what the doctor do is that doctor just cut some part of the thyroid gland which is having inflammation or any type of abnormal growth, so that to stop the more spreading of that cancer to other part or other cells of the thyroid gland. So it is a surgical procedure. So Graves disease. So how to treat this Graves disease? So here first of all orbital decompression surgery is there. Here the doctor will remove bone between the eye and sinus. So it improve vision and provide space for the eye to get back to its previous position. Eye muscle surgery, as due to Graves disease, as we seen in the previous slide that there is proptosis, due to that eye muscles are affected. So and they were not able to move the muscle properly. So for this reason eye muscle surgery is there to elongate or to reduce according to the need, to move so that to move the eyeball properly. And also uh, the main thing is that the damage to the eye will be reduced by proper treatment of hyperthyroidism. if we treat the cause, then we can treat uh, the Graves. We can stop the Graves disease, as we are treating the proptosis or any type of ocular disorders, but we are not treating the thyroid hyperthyroidism, so it will not affect. So first of all, we need to treat the hyperthyroidism. That means we need to reduce the thyroid hormone from the bloodstream, and then after treating it, we will proceed to ocular damage treatment. So that's all, friends. Thanks for watching, and please don't forget to like my video and subscribe to my channel. Thank you so much.